Okay,
So
dear learners,
I'll take.
I welcome to Professor Kapadia. I mean, no doubt, he's an excellent academician and he's a very good teacher. I welcome you, sir, on behalf of Regional Center Bhubaneswar, on behalf of IGNO headquarters. So today, sir is going to discuss impact of infection and prevention and control of environment. So sir is going to talk today this. So I welcome you, sir, to today's session.
Thank you.
I hand over the session to sir. Sir, you continue the session.
Hello.
Yes, sir.
Yeah. Thank you very much, sir. So today I uh, share the experience, and I'm going to talk on the infection prevention and control program that one institute or hospital or healthcare organization has to prepare and implement, which also include the prevention aspect and control aspect both. So I am sharing my PowerPoint.
Hello.
Yeah, hello.
Sir, good afternoon.
Good afternoon.
Sir, what is the topic today for class?
Today's topic is infection prevention and control.
Okay, sir.
Yeah. Is it visible to you?
No, sir, only plain display.
Only plain display. Okay. I'll
Ji.
check. Hello. Hello.
Hello.
Yeah. Is it visible? My screen is visible
No,
to
sir.
you or? Yeah,
No,
I'm
sir.
trying. Ah, some technical error. Now, is it visible now?
No, sir.
Hello.
Sir, no visible.
Still not visible.
Yeah.
I can't set up.
Now visible? Hello.
Yes, sir. Display is visible but not clear.
Not clear still. Oh.
आप ही दे दे information जा रही
Is it clear now?
No,
Hello.
sir. Ah, sir, it is clear now.
Clear now, na? Yeah. So
Yes.
we can start. Yeah, so I'm Dr. Sanjay Kapadia. I'm looking after Government Spine Institute and IGNOU Learner Study Center. I'm also looking after the quality aspect, infection prevention and control, and OSD, Officer on Special Duty for the Medicity, Ahmedabad. So you can see the various bugs that is present in the environment of the campus of any institute. So you must know what is infection first of all, and what is HAI. That is healthcare associated infection. So that is the infection occurring in a patient during the process of the care of the patient in the hospital or any other healthcare facility which was not present or which was incubated at the time of the admission. But the actual, as you can see, or the actual definition, the patient comes with some other complaint and he or she develop any kind of the symptoms related to the infection after 24 hours of admission in the hospital and develop an infection that can be considered as healthcare associated infection. Previously, it was referred as nosocomial infection, hospital acquired infection, hospital infection. So, this is the definition what is HAI, and that is also occur in healthcare provider also, that is occupational hazard for the staff working in the healthcare facility. So you can see, many of you have learned about the epidemiological triad, how this infection uh, occurred in the patient or in any human being, particularly when we discuss about the healthcare associated infection. So as you know, there are three factors. One is the agent factor, third is the second is the environmental factor, and host factor. So you can see everywhere there is a microbes, variety of organism, even in the environment, on the surfaces, everywhere. In some other person, in some patient, as we have all experience about the COVID, that is a contagious, that is also an infection. If the patient is coming with the infection like contagious infection or infection like COVID, our staff also get infection from that patient. So that all are the agent that come to with in contact with the patient or any human being from various places. And even the there are reservoir, there are depend on the virulence of the agent. The second factor is the susceptibility of the host. It depends on the age, the nutritional status, comorbidity, severity of the underlying disease and the environmental factor, as I told you, the any institute like hospital, the healthcare institute is a factor for any of the HAI. Diagnostic procedures, because we conduct so many diagnostic procedures, starting from the examination, then any kind of surgical intervention, procedural investigations, then immunosuppressive agent that we are giving to the patient, particularly of the cancer patient and other transplant patient and all, chemotherapy, antibiotics that we are using. Almost in India and anywhere, everywhere, the role of the use of antibiotic, because everywhere irrational uses of antibiotic lead to the resistance to the microbes, and that also lead is a factor for the hospital acquired infection. Medical surgical device can be a factor for the infection. As I told you, exposure to the infected patient or health worker and some asymptomatic carrier. So these are tried how this infection or a patient get infection. These three factors, this host, agent, and environment, it is necessary to have infection. These three factors should meet. So these are burden everywhere. You can see the studies are reported regarding the HAI. So it is more in the, I think in the pediatric or children age group, because they are more susceptible than the adult. Even it is more in the geriatric population if they are admitted in the hospital or any healthcare institution. You can see all countries, the occurrence of the HAI, 7 to 10% of the patient develop HAI. One in four, a quarter of healthcare associated infection in long-term acute care setting are caused by the antibiotic resistance bacteria. ICU, there are chances of more infection in ICU because patients are very susceptible, highly susceptible for the HAI. And the development of the resistant flora. So initially, infection prevention and control was not a part of this CSCWM program, and I talked with the coordinator that it should be there because it is a part of the healthcare waste management program, because the worker and the waste create infection, HAI. So why are HAIs important? It is the most common adverse effect or adverse event we can say, because any patient is coming for the, I can say if patient is coming for the plant surgery and if he or she get an infection during the stay in the hospital, then it is a gift, we can say adverse gift to the patient. So it is very important because it increase the burden to the institute. And it is also a major public health issue affecting the morbidity, mortality, and quality of life of the patient. So HAI results in prolonged hospital stay. As I told you, the patient is coming for the plant surgery and he or she get an infection, so his stay definitely will increase. The disability, it can increase. Resistance, because of the infection, we have to use the antibiotic and antimicrobials. So again, the chances of developing resistance to the antibiotic is increased. Cost to the system, health system, and also cost to the definitely the use of the antibiotic and long stay. It also increase the cost of the patient and then family. So it is a preventable things by the IPC measures, to prevention and control measures for the infections. So if we say the patient safety matrix and patient safety framework. This is the pillar. The prevention of the infection and reduction in the HAI is a pillar. So we have to control of the healthcare associated infection. Everyone should know the safety goals, the patient safety goal. If patient is coming to the hospital, and we have to consider the safety goal. Then WHO and national has given a guideline. These are the safety goal, and one of them is the healthcare associated infections. So this is a framework that we are working for that. The structural system for the quality and safety assessment and reporting of such kind of event infection, we can say for that. Then competent and capable workforce, control of HAI, strengthen the patient safety across all programs, and promote patient safety researches. So antimicrobial resistance containment is a component for that also, infection prevention and control. So this is a chain of the action. As I told you, I mentioned how this infection, our patient get infection. The infectious agent either through reservoir, portal of entry, means from where these microbes enter into the body and from where we can control. So this is a chain that you must understand because the infectious agent, we have to identify the agent immediately and we have to act accordingly. We have to break the reservoir also. Then we can find the reservoir, maybe the environment, your sanitation, your health. We can check for that. Disinfection and sterilization, proper cleaning. We can stop here at the entry point, the portal of entry. So proper etiquette, hand washing before and after any procedures, before and after touching any hospital equipment, trash and waste disposal, proper waste disposal, collection, segregation and disposal. That also prevent the entry, and control of excretion and secretion. That means we can reach the means of transmission. So that can be done through hand washing, to sterilization, disinfection, airflow control. So proper ventilation and proper elimination, airflow, unidirectional movement, everything that can be controlled. Food handling, of course, food is also can be a factor for the infection. Then isolation that we have seen in the era of the COVID. The patient with the infection like the tuberculosis and COVID, we have to keep him in isolation to prevent the airborne infections. The portal of exit, we can act by the proper aseptic techniques, as we have to always follow the proper aseptic technique before any procedures, proper catheter care, proper wound care. Then in the susceptible host, we have to provide a proper immunity, treatment of underlying diseases, and recognition of high risk clients. So every organization should prepare their infection prevention and control program, and accordingly they have to implement that. So this is a plan. You have to do surveillance, regular surveillance of your high risk area, your low risk area, your medium risk areas, environmental surveillance that you have to do. Then you have to regularly monitor and check, audit. You have to do regular monitoring of all areas and auditing of all the procedures, all the activities. You have to develop your own antibiotic policy. to prevent the resistance flora, you have to start with the broad spectrum, then the specific. You have to restrict your higher antibiotic. You have to keep your higher antibiotic for the reserve procedures. Reporting and isolation of the diseases, including outbreak management. And the most important thing is training of the staff and even the patient and relative for the prevention of the infection. So there are some standards as all the there are some standard in India. Quality Council of India and ISQA has mentioned some standard. NABH, then NQS has measured and find out the standard for the infection prevention and control practices in the hospital. It is applied to all the healthcare institutions, and that I explained you that every hospital should have that documented infection prevention and control program, which aim at the preventing and reducing the risk of healthcare associated infection in the hospital and healthcare facility. It should contain structured program. And what is the aim of the program? The aim of the program is to reduce the healthcare associated infection to such a level or to near to a zero. Should include all the process, all the activities, all areas, all the surveillance procedures, and has to be developed as per the institution, as per the organizational priority. Depends on the current scientific knowledge and should follow the current and national and international guideline, CDC guideline, then WHO guideline, and other statutory bodies requirement and guideline. As per the program, every institute has to identify the high risk areas, first of all, high risk activities. These high risk areas and activities should be based on the scientific literature. If we say the high risk area in the institute or in the hospital where the high risk activities are performed, like operation theater, that is again a high risk area because it is an area where the intact skin layer is being cut during the procedure or any portal of entry is open in this area. So like CSSD where the sterilization and disinfection practices are happening, so that you have to identify as a high risk area. And your ICU where all the vulnerable patients are there, those who are immunocompromised or those who are on an antibiotic or those. So your ICUs are high risk area. And depending on your area and your procedure that you are doing in your institute, like surgical procedures, like intubation, like central line, like scopy, endoscopy, bronchoscopy, all the activities that catheterization that you can identify as a high risk activity where risk of getting HAI is very high. So the other are the performing the procedure, the aerosol generating procedures like intubation, the chances of high. Handling of blood and blood fluid spillage, specimen, sharp, exposure to contaminated medical devices, equipment, and biomedical waste. These all are the procedures where the chances of getting infection is very high. So we can also prevent by identifying and promoting the standard operating procedures to prevent the infection in hospital. We can reduce the infection. The program should be reviewed and updated regularly. So it should be reviewed and updated every year. or as and when required. In between, if you add some new procedures, you add some new areas, then you can review your program accordingly and update. And it should be updated on the basis of new literature, new any guidelines, any outbreak, new outbreak, and the SOPs is newly developed. The guideline is released by the authority. The trend of the infections and the outcome of the audit process. Whatever you are auditing and you are finding the observation, then we can update your program. You have to update your infection prevention and control program by using a WHO tool. It's a validated tool for the facility level. And also, you can use the CDC infection prevention and control tool for acute care hospitals. So, as an administrator, you have to define the committee for your program. Who will look after the program? Who will develop? Who will review? So, you have to identify the people who will look after this program documentation, then implementation, making guideline, making SOPs of the healthcare associated infections. So the minimum guideline or minimum requirement of the committee members, then as an hospital administrator, you can be the member. It is mandatory to have microbiologist or a person who has a knowledge of infection prevention and control practices, either microbiologist or a physician or infection control specialist. You can add surgeon, any surgeon, general surgeon, orthopedic surgeon, super specialty surgeon, any. You should have infection control officer, who is the person who is looking after and coordinating the activities of the infection prevention and control, and who regularly do the surveillance with the infection control nurse, and who has the knowledge of entire infection control practices. Then nurse manager, because majority of the activity is done by the nursing staff, those who are working 24/7 with the patient, and so the all the nursing staff are representative. Then the person from the high risk areas, as I have told you, CSSD, OT, ICU, the person to have knowledge to help the committees in developing the certain procedures regarding the ICU, OT, and CSSD. Then the person from the support services like biomedical engineer, because who is looking after the biomedical engineering part, who is looking after the equipment, the cleaning, the process, in the operation theater, in ICU, the ventilation, the validation of the filters and everything. And other invitee, you can add the person from various areas, various clinical and non-clinical areas. You can also add your sanitary staff or your sanitary supervisor or sanitary inspector, whoever is available. You can also add your security person to train all the person in the access control activity, because the persons, more number of the persons entering into the particular access control area, that can also increase the load of the infection to the patient. So this may be the committee members who has to develop, approve the infection control program, and forced to implement the program into the institute in all area across. Regularly, your committee should meet monthly or quarterly. So you come to know what is the trend of the infection, what kind of infection is occurring in your hospital. I'm talking about infection means HAI, healthcare associated infections. So So day-to-day activity of the infection prevention and control, prevention and control practices into the healthcare institution, we would have one team who is looking after the implementation part, monitoring and auditing of the practices. So the function of the team is to day-to-day functioning of infection prevention and control program, support the surveillance process, detect any outbreak inside the institution related to the infection. This team participated in auditing activity, auditing related to your hand hygiene audit, your use of various care bundles audit, your infection rate audit, and capturing of the raw data, HU, usage of antibiotic audit. This is an activity that is the functioning of the infection control team, and that you have to develop as per your the size of the organization, type of the hospital or type of the institute. Either institute is working for the acute illness or chronic illness. It's depending on the type of the organization also. The minimum member of the team are infection control officer who knows everything and infection control nurse. This two person has to do a regular implementation program activity in entire institute. And this team has to represent the outcome or outcome of the audit to the committee for the further review of the program and find out the type of the HI occurring, the trend of the HI, the implementation observations, and any deficit. And committee finally review the program as per the recommendation of the team and observation of the team. You should know who can be the infection control officer who has the knowledge about the infection control practices as per the current guideline, current statutory guideline, CDC guideline, NACO guideline, or you have to define the role of the infection control officer, what he or she has to do. Then after infection control officer, you should have one infection control nurse. That is also depend on the bed strength of the hospital. The minimum criteria that is given by the nursing council is 200 or 250 bed, 50 per patient, 50 bed per patient. Should have undergone additional training. Any staff nurse who has taken a training for the infection prevention and control program, structured program, he or she can be a infection control nurse. So what is the responsibility of infection control nurse? So as I told you, I mentioned that the day-to-day activity of surveillance of HAI, organism, the monitoring whether the program is implemented properly, compliance to the monitoring, education to train all the persons, not only nursing staff, but also to doctor, to subordinate, to housekeeping staff, and whatever the activity he or she is performing, he has to document and present to the committee. Point to be remember the compliance monitoring. What the ICN has to do? He has to monitor hand hygiene, whether all the persons are performing hand hygiene appropriately, and whenever there is need. Transmission-based precaution, isolation, infection-specific bundles, use of infection-specific bundle. As I told you, care bundle for the procedures, the disinfection and sterilization procedures, and the checklist for all the compliance monitoring. Organization implement IEC program for HIC. We can say HIC. IEC for HIC. So, organization and stakeholder create information, education, and communication message regarding the infection prevention and control program. Organization should conduct regular induction training for the infection control practices and regular refresher training for all the staff. It should include hand hygiene, how to perform hand hygiene, when to perform hand hygiene, the uses of antibiotic, prophylactic antibiotic, appropriate antibiotic, use of PPE, how to wear, how to doff, how to don. Then a CO has to participate in managing community outbreak. As we have all passed through the COVID, that was a pandemic, that was a COVID outbreak, that was a pandemic. So all the hospital has to implement this program during that time, COVID time. The donning of the staff, the doffing of the staff, donning, doffing of PPE, the training, how to don, how to doff, how to hand wash, the use of various alcohol-based hand rub and all. So every SU has to participate in the outbreak also inside the hospital and also into the community outbreak. The regular camp for the this infection prevention and control practices outside also, how to prevent. And as an administrator of institute, what is the responsibility of the administrator and management? You have to implement, you have to enforce the implementation of the program, infection prevention and control program. For that, you have to make avail all the resources, which include man and material, whatever the requirement. You have developed an infection prevention and control manual, and the resources for that is not available. If PPE kit is not available and you are saying that you please enter in the TB ward or TB patient ward, so that is dangerous to the staff if you are not providing the PPE kit. If you are not providing N95 mask, then it is harmful to the patient and staff also. For that, every management has to provide adequate fund to the budget. That's why during planning of the budget, during budgeting, every year, the portion of the infection control practices, everyone has to consider the budget for that, which include the supply of the material, the supply of the manpower for prevention and reduction of the HA. Adequate and appropriate personal protective equipment should be available everywhere, wherever it is required. If you are performing the procedure and the PPE is not available, then it's not good. So the proper PPE and in a proper quantity PPE should be available. Should include from top to toe, gloves, your goggle, mask, apron, gown, boots, or shoe cover, cap or hand. Remove PP after use and should not be reused. Any HCU has to provide the facility for hand washing in all patient care area. Because as you know, 80% of HAI can be controlled or prevented only by proper hand hygiene, proper hand washing. So it should be available, large wash basin. You have to remember that your wash basin tap should be hands-free, either foot operated or elbow operated. Just like in the operation theater, you have seen the scrub where the tap is hands-free, either sensor operated, soap, liquid soap, and do not use the hand dryer because hand dryer is a source of the infection. It increases the chances of infection. So don't use hand dryer. Hand rub facilities like in ICU, it is very difficult to wash every time from one patient to another patient. So you can use hand rub, alcohol-based hand rub. So every institute has to install dispenser. The convenient point. The isolation barrier is a part of the infection control practices, isolation or barrier nursing facility. So there you have to keep patient like a patient who transmit patient the infection from one person to another patient like tuberculosis infection, COVID infection. All the airborne infection. You have to keep all the patient in the isolation facility, which has a negative pressure. So the infection or microbe from inside cannot enter into the other part of other area of the hospital. So which patient required isolation or barrier nursing that you have to define. Like example, I have told you the COVID patient, tuberculosis patient, your H1N1 swine flu patient. You have to provide clothing, mask, and gloves to the staff who is entering into the isolation. Ensure your door to asylum or other room are always closed. Patient who require isolation, either contact, droplet, or airborne in isolation room, you have to keep. In airborne cases, as I told you, negative pressure room and display proper signage that this is negative isolation. So don't enter inside without wearing PPE kit. All the organization should adhere to the standard precaution at all time. All time. The universal precaution, we can say. Hand hygiene every time. So these are the 5 steps where we have to wash our hand or we have to maintain hand hygiene. First of all, it's before touching of the patient to prevent the transmission of infection from staff to the patient. Before cleaning or before any aseptic procedure. Third one is after body fluid exposure risk to prevent ourselves. For this, after touching a patient, that is
Excuse me,
also
sir.
to prevent ourselves and transmission. Fifth is after touching patient surroundings. So these are the 5 moments that you have to display everywhere in your hospital, and you have to train your staff to prevent the transmission of patient surrounding to the staff or to other patients.
5 moments of hand hygiene.
Yeah.
Hello.
So these are types of hand hygiene, how we are performing the staff, various staff. One hand hygiene that we are doing regularly is the hand washing with soap and water by using of the alcohol-based hand rub, and the surgical procedure where we are doing surgical hand scrub. So these are WHO guideline and steps that is available how to do hand wash and how to wear gloves and how to remove the gloves. This is a guideline which is available on net and provided by the WHO. So this is step 1. Everyone must implement these things in your institute, and everyone must start from yourself. Do you know how to hand wash? Do you know the steps of the hand washing? What is the first one? What is the second one? You have to do this procedure for 40 to 60 seconds. Hand washing. Hand rubbing. When you are using rub, then the procedure. These are the actual 6 steps that you have to follow and display this to your wash station just in front of you when you are washing your hand, and start doing like this. Start following these steps. The palm to palm, back of both hands, interfingers, rub hand together, interlocking, the thumb rotation, then your fingertip, cleaning of your fingertips and your underneath of your fingernails. This surgical scrub up to elbow. The adherence to the transmission-based precaution should be followed in all area of the organization, and identify and use of appropriate PPE. There is no need to use or wear all the component of the PPE every time or in all area. You have to identify appropriateness where you have to use full PPE, where you have to use only mask and goggle and surgical gloves. But you have to take into consideration the mode of the transmission, whether it is airborne, chances of airborne, droplet, and contact, and accordingly you have to use your PPE.
એક્ઝામ ફોર્મ છે કાલે મોકલાવાનું છે અર્જન્ટ.
The most common, if anyone is from the nursing, anyone is from nursing? Hello? Hello?
Yes, sir.
Anyone
Yes.
is from nursing? So the safe eye practices and safe infusion and injection practices. You have to train all the nursing staff, all the person to follow this safe injection practices. One needle, one syringe, only one time use of, and no recapping and no reusing. For any catheter also, no reuse, one time and use, and no recapping. This is most important to develop your antimicrobial uses policy. First of all, you have to define your antibiotic policy as per the your antibiogram. Antibiogram may be different for your different areas, different for different institutions. It is depend on the organism present in the institute or organism which is there in HCU or in area or in a particular patient. So you have to develop and design your antibiotic policy as per your antibiogram. Should be developed by keeping in mind the type of the antimicrobial agent, method of administration, one time or combination therapy, escalation and escalation, the first line, second line, third line, like then doses and duration of the antimicrobial therapy. And you have to develop a mechanism to monitor the antimicrobial usage also. And the susceptibility is based on the culture sensitivity. Based on above, you have to develop your own policy and you have to monitor and evaluate, and you can change accordingly as per your audit result and evaluation result. You can review regularly or at least every year you have to review based on your uses and on your audit. Step-by-step approach for the development and implementation of antibiotic policy based on the standard treatment guideline by WHO and Government of India guideline also, CDC guideline. You can develop your own usage policy. The rational use of the agent, you can start the monitoring from the prescription, the prescribing personnel for the doctor prescribing the antimicrobial agents, whether they are prescribing as per the policy or they are prescribing irrationally, that you can monitor. If they are prescribing irrationally and higher antibiotic, then you can restrict. You can change, you can ask, you can call why you are giving without any cultural sensitivity. These all are the restricted antibiotic. So you have to give evidence to prescribe that you have to. Then because nursing staff has to give the antibiotic and the doctor is prescribing. So after prescribing, the nursing has to check whether it is as per the policy, whether it is as per the antibiotic policy, whether it is restricted antibiotic or not. And you can call doctor or you can talk with the doctor that this is restricted and we cannot administer this kind of antibiotic without any evidences, even you have prescribed. Inform deviation to the concerned clinicians, as I told you, and you have to give your observation to the committee and team, infection control team and infection control committee, the deviation and the correction that you have done. So the committee will decide what to do. Every HU has to participate in antibiotics towards program. So this infection prevention control program particularly is focusing majorly on the prescription of the antibiotic, uses of the antibiotic, and the other aspect also. Prevent the resistance antibiotic. The engineering control, the other component of the infection prevention and control program is the engineering control. So where you find this engineering control? So you have to design your institute your OPD, your OT, your ICU, as per the norms. As per the norms, you have to design your ward. The distance between two bed, design of the patient care area, 1 to 2 meters spacing between beds. The design of the operation room, design of the ICU, location of the ICU, because ICU and OT and all this high risk area are a restricted entry area. So you have to design accordingly to prevent the entry or restrict the entry. The regular check and maintenance of AC plant, air conditioning plant, and equipment. Regular cleaning of AC duct, filter, as we are using HEPA filter in the ICU or OT, the patency, the velocity, particle count of the filter, and that you have to validate, check whether it is okay, accurate, passed. Otherwise, there are chances of getting infection is very high. So you have to regularly check for the filters also. Regular monitoring, maintenance, and repairing, and if required, replacement. Prevent fungal colonization, maintain temperature, humidity into OT operation theater room, because the humidity and temperature both help in the breeding of the microbes, and that is also a source of infection. Water management, water supply to the hand rub and scrub, regular testing of the potable water, because if the source of the infection is in the water, then it can to increase the number of the HAI, either waterborne disease, waterborne HAI. So you have to check regularly the potable water, the RO water that is supplying to the dialysis unit, your scrub in the OT. So regular check is required, which is mandatory. You have to plan for the reduction in the risk of infection during construction. If any activities is going on or it is planned for any changes, any construction, any renovation, so you have to plan accordingly, and you have to shift the process and activities from that area to reduce infection, because the activity like construction and renovation can increase the chances of infection or increase the risk of the infection. The another component of the HAI is your housekeeping procedure and housekeeping services, which include the cleaning of the floors, cleaning, and everything, all level. Because housekeeping is required in all areas of the organization, all your ward, OT, public areas, toilet, corridor. The regular cleaning to remove your visible dust, and all surfaces, all your fixture, furniture, mobile equipment, and everything. You have to develop your cleaning frequency either twice a day, twice a day, and depend on the activities, on procedures, and utilization of the area and equipment. You can divide your areas accordingly, and you can develop your frequency of housekeeping as per the activities. It maybe depends on the number of footfalls, type of activity, as I told you, clinical and non-clinical area, and probability of being exposed to body fluid for a OT and lab example. It is preferable that all the healthcare facility has to follow uniform housekeeping policy across different departments. For housekeeping, what kind of disinfectant you are using, that you have to define. You have to check for the efficacy of the disinfectant also. The dilution, in what dilution you will use, and you have to train your housekeeping personnel also regarding the dilution procedure, dilution protocol. Terminal cleaning protocol you have to follow. Terminal cleaning for the spillage, for body fluid cleanup, cleaning of isolation areas, cleaning of all the handles and all. And for that, you can use the CDC guideline for disinfection and sterilization 2008. The waste we are generating, as you all know, that this is a CSCWM program, and biomedical waste, as you all know about it, uh, you have to segregate at a point of generation. Segregation of biomedical waste, that you have to train each and every person. And person who is handling, they have to wear PPE kit, because chances of getting infection is very high. Segregation at source, transportation and collection, temporary storage, as per the biomedical waste management rule and act, and final disposal. Effective management of biomedical waste is necessary for this prevention control program. The another source of getting infection is your linen. So you have to develop the laundry and linen management procedures. The washing of soil infected linen, disinfection of the infected linen, then the sluicing, and then washing, cleaning, and then clean and sterilization of the linen. Frequency of changing, when to change, daily changing, even after the some procedures or after getting soiled, the changing protocol. Your laundry can be in-house or outsourced. You can outsource it. For outsource, you have to check whether the laundry person is following proper procedures or not. Otherwise, your infection prevention control, you are doing everything is good, and your linen and laundry is not proper, and laundry is coming is outsourced, and your linen is was outside, and he or she is not following proper procedure protocol, and the HI can be the from the your infected or non properly used or washed linen. The another component of infection control program is your dietary services, your kitchen sanitation and food handling. Your kitchen can be in-house or outsourced, but you have to check for the uh, entire process of preparing food, whether the food is proper, then washing, cleaning. The chances of getting foodborne infection is from your kitchen. So you have to screen your kitchen handler, your food handler also for the salmonella, for the typhoid, for your enteric and hepatitis A also. You have to check for the preparation procedure, handling, storage,
Hello.
distribution. Yes, sir. Yes, ma'am.
हेलो
Yes. Hello.
एक्सक्यूज मी सर सर ये डाइटरी सर्विसेज में आपने बताया सर डिजाइन इन ए मैनर दैट प्रिवेंट्स क्रिस क्रॉस ऑफ ट्रैफिक मींस
Yes. So you have to design your kitchen services according to the your in a unidirectional flow. As you receive your raw material from one side, then preparation, cutting, chopping, washing, then cutting, chopping, and then your cooking, then supply. Just like your CSST and OT, you have to design just like that. Even the transportation of your food, that you have to uh, prepare or plan a route. So your food, which is distributed or which is going to be distributed to your patient, it should not be crisscrossed with a biomedical waste trolley and all. So the timing
Okay,
and
sir.
the route It can be a
Okay.
separate.
Okay, sir. Thank you. Continue.
You have to check for the storage, your refrigeration where you required or you require the preservation of the food. You have to keep all the product off the floor to prevent chances of rodent. You have to check for the rodent, pest control and all. Ensure the flies and insect do not come in contact with your prepared food. You have to keep close or in a close insulated container also. You have to supply your food in an appropriate food service trolley. Temperature, you're insulated. I have told you the insulated food service trolley. This infection prevention and control program, you have to monitor your indicators. That is standard indicators referred. You can refer the CDC, WHO, and CA guideline. The 4 indicators where the chances are higher. One is your urinary tract infection. Second is your ventilator associated pneumonia and complication in your ICU that you have to measure. Your bloodstream infection, that may be your central line or peripheral line infections. And fourth is your surgical site infections. So for that, to prevent, you have to develop your care bundle accordingly for this 4 infections. Your surgical site, you have to pre-op, post-operative and intraoperative care bundle that you have to develop. For catheter, you have to develop your catheter link bloodstream to prevent care bundle for the epilepsy. For VAP, you have to develop care bundle, and for UTI, you have to develop care bundle. Care bundle is the instruction that you have to follow step 1 to step last. Whatever the instruction procedure that you are doing, aseptic precautions that you are doing, that is your care bundle that you have to follow, check, and check. Then finally, you have to track and analyze the risk, rate, and trend to improve your practices, to further strengthen your infection prevention and control program, to check whether the staff is adhering to the practices. So you have to collect data, you have to do audit, you have to collect surveillance data, consolidate into annual report, analyze and check and do correction and prevention action, take suitable steps based on your analysis. You have to validate also your data from the team, whether the data is correct or it can be wrong. You can do random sampling also for that. High risk activities, you have to do regular surveillance of all your high risk activity. You have to define your frequency, and you can do weekly, you can do monthly, you can do quarterly. But I suggest that high risk activity you have to do surveillance minimum monthly. Surveillance activities should be done following areas where you plan for the demolition, for the construction, and any repairing work that you are doing. Surveillance include hand hygiene, compliance, monitoring of uses of hand hygiene from WHO observation form. Surveillance also include capturing of occurrence of multi-drug resistance (MRSO). Surveillance also include effectiveness of housekeeping services, whether your housekeeping services is effective or not. That you have to check regular checklist using they are doing effectively or not, monitoring of their processes, whether they are using proper dilution for disinfection or not, that you can check. Then you have to take feedback, or you have to give feedback of your data also, or your indicator to your staff and all others. So on the basis of that, they can improve. That our trend is improving, our rates are getting down, so our activities are good. And feedback to the healthcare provider, those who are working in the hospital, to give your analysis, your indicator to your staff also. Circulate through bulletin or newsletter to get their input. Appropriate action to control outbreak of infection, outbreak inside the hospital canal. So you have to find out the outbreak also. You have to follow all the steps of outbreak. Early identification for the outbreak. You have to, if you do regular surveillance, then you can identify early the outbreak. Then define what constitutes an outbreak. Handle an outbreak. Your all step of outbreak investigations and control. Surveillance data is analyzed, appropriate corrective and preventive action that you have to take. You have to submit your data of surveillance regularly in the infection control committee. And also you have to submit the recommendation, your observation and recommend what to do to prevent further and to prevent the recurrence of this kind of HAI. Provide adequate space and appropriate zoning, as I told you, to sterilization in OT and sterilization practices. This is regarding your CSSD. Zone 1, 2, and 3. So unidirectional flow, as I mentioned, the CSSD should be at restricted area, restrictable location, proper layout, proper joining, unidirectional flow of the material from clean to the sterile, separation of clean and dirty area, and proper space. Cleaning, disinfection, and sterilization practices that is to prevent infection. Cleaning help in removing visible biological material and dirt. Just cleaning. Disinfection. What is disinfection? It's a process where most microbes except bacterial and endospores are removed from disinfected object or surface. And sterilization remove spores also. So you have to follow the cleaning, disinfection, and sterilization practices in your CSST. The classification, patient contact, intact skin. Example, what type of the article that you have to clean by what. So if your skin is intact, there is no need, it is not critical. So you can just disinfect intermediate level or low level. When your mucous membrane or non-intact skin, the instrument is come in contact with your mucous membrane or non-intact skin. So you require high level disinfection. And when sterile areas of the body, including blood contact, when any instrument or equipment is come in contact with your blood, then it is very critical. Then you have to use sterile equipment and you have to do sterilization of that equipment. So this is a process of cleaning, packing, disinfection, sterilization. Then you have to store your sterile equipment in your sterile store. Then issue. You have to develop your policy SOP accordingly. You have to also develop your reuse policy, which instrument or which devices that you will reuse after sterilization. Reprocessing of single-use instrument, equipment and devices that you have to design and develop. And how will you check? You have to regularly check your sterilization practices. Validation of your sterilization, whether your sterilization is proper or not, whether the temperature, pressure and time record chart. You have to, for each cycle, every cycle that you have to monitor whether the temperature during sterilizer was as per the guideline, pressure was as per the guideline, and timing of the cycle, sterilization cycle is proper. You have to check for the chemical sterility by the chemical method using the test strip. You have seen the test strip that the color is changing. That is a chemical indicator. And you have to use biological indicator at least weekly. That the spore is available, biological spore, and that you have to use that indicator at least weekly. For engineering validation, whether your sterilizer is working properly or not, you have to do voidic tape test and leak rate test. You should have established recall procedures. If your validation results are not proper, or if you have any complaint after opening of the sterile drum or sterile plates, then you have to recall that load from all areas. So you should have recall procedures in case of any breakdown in the sterilization system. You have to check all your staff, occupational health and safety practices. All your staff, you have to do regular health checkup, annual health checkup at the time of the joining and also annually. You have to do a regular employee health checkup screening and provide the immunization vaccines, hepatitis B vaccine and tetanus vaccine. And those who are working in the kitchen and food and you have to provide hepatitis A vaccines also and typhoid vaccines also. The immunization policy accordingly that you have to develop and you have to implement. You have to implement work restriction for the healthcare provider with transmissible infections. If any of person is has a airborne disease like or acute conjunctivitis, chickenpox, or upper respiratory tract infection, or spear positive case of TB, you should develop a policy for the restriction of working in the hospital or healthcare institution without any penalty. Develop a measure for the blood and blood flow fluid exposure prevention. Train all the staff to use PP, provide PP, provide needle care, needle devices with safety features, and also train for the needle stick injury protocols. That's why I told you a safe eye to prevent needle stick injury or prevent sharp injuries. If any incident like needle stick injury or sharp injury occur or any exposure, so you have to develop a policy or design a policy for the prophylaxis, post-exposure prophylaxis, and you have to follow the NAPO guideline for the needle stick injury. So you have to do develop your pre-exposure and post-exposure prophylaxis policy also. So let's break the chain of infection to prevent the HAI. Hand over wash is a message. They break the chain of infection to prevent HAI in hospitals. Thank you. Any questions? Hello.
Thank you, sir.
Any questions?
Yes, sir. Hello, good evening, sir.
Hello. Good evening.
Oh, sir, I am from the Jamnagar and I have just allotted study center is the Spine Institute, Ahmedabad.
Yes.
But, sir, I don't know the whether there is a study center available.
Study center.
I allotted the study center is the Spine Institute of the Ahmedabad. Hello.
Hello. Hello. Hello. Hello. Hello.
Hello.
Hello. Yeah. Hello.
Yes, sir. Good evening.
Good evening. Any question related to infection prevention control practices?
No, sir. I have the question related to study center that is the in Spine Institute.
Okay. So
Sir,
what is your
how
question?
does our assignment to the study center?
Hello.
Yes, sir. I have the question related to the assignments submitted to the study center.
So what you want to know?
Sir, study center in my study center is the Spine Institute of the Ahmedabad.
Okay.
But whenever I search in the Google, that is the Spine Institute Ahmedabad IGNOU Study Center, there is no result showing me.
Okay.
So,
But we
sir, could
are.
you give
you-
address of
Okay.
the study center?
It's a spine institute.
Okay, sir. We are just
Government
search the
Spine
Spine.
Institute, Ahmedabad is a study center.
Okay, thank you, sir.
Hello.
Yes, sir.
Actually, sir, one more class is there or finish now?
No, this is over.
Over.
Any
Tomorrow?
question?
No, thank you, sir.
So, Hello.
Sir, mic is off.
Hello. Hello.
Hello. Hello.
Hello.
Yeah. Hello.
Sir, one query is there.
Okay.
Sir, for workshop, what I have to do? I want to join the workshop also online.
Online workshop for what?
Sir, online workshop for CHCWM course.
Okay.
Sir, yesterday Monica ma'am told me that if you want to join the workshop, you have to contact some IGNOU center, but there is no response. I did call there.
So, if any query related to infection prevention control practices, I can answer. I cannot answer any administrative question. Please.
Okay, sir.
Hello. 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 Hello.
WhatsApp पे
क्लास बंद हो गई क्या?
Hello. Hello.